You're mute, you're mute, you're mute. You need to unmute yourself, yeah.
So Soumya, you can ask your question. Sejal is Tina, second year student now. She'll go in the third year. Medicine student in University of Marche, Italy. So whatever the queries you had regarding studying here in Italy, safety, security, and everything, you can directly ask. So I wanted to know about scholarship part. Okay, I think the HEC's team will be able to help you out much better with that. But then in general, the scholarship you will be allotted around like 8 to 10,000 euros depending on the city that you are in, and that basically covers your living expenses, your accommodation, your living expenses, food, groceries, and you'll still have a remaining amount, the stipend, which usually personally I take of like a trip around the country or maybe in the EU since I have the permit. So that is what I do. So I think, but with the documentation and other questions, I think the AGC team will be able to help you out much better than I could. How's the uni life there? Like the safety for girls, and how many Indians are in your batch? Okay, so basically, right, I am studying in Ancona, which is one of the cheapest cities to stay in, but it is very safe for me. I can go out at like 1 o'clock in the night, and there's always police in the carabinieri that are always circling and patrolling around the place. If you have anything, if something is wrong, or if you lose anything, right, they will. You can always go to the this my friend lost his he lost his debit card, and he was able to get the money back as well as issue a debit card again. So the safe on as a girl, I can vouch that it is pretty safe here. And with the university also is really involved in your life, right? Involved, like if something were to go wrong, if you're feeling unsafe, if you're getting bullied, which they have anti-bullying laws, but if something happens, they will always be there. They will constantly remind you that if you have something going on in your life, please let us know. If you want we have free counseling as well. So if you want help, mental help, you can ask for help if something is going wrong, if you don't like the course or the teachers are not talking, if you know anything, they are very involved in that front. Talking about my university life, it is very hectic. I question myself for choosing, but it is really nice. I have classes from 8 to 4 o'clock, but they're really nice. The teachers give you breaks in the middle. The teachers are really sweet. I love looking into research a lot, so I do ask my teachers, oh, what is the new research, or if I'm interested in a particular topic, I will let them know, and they will help me out with finding research papers. So the more you interact with your professors, this is my personal opinion, the more you interact with them, the friendlier they get with you, and the more the more you will learn from them apart from the course itself. With the international students, so Ancona has one of the largest international. They offer 60 seats for international students. I think Catania also has, yeah, 60 seats. So we have a lot of international kids. You'll have kids from Brazil. You'll have kids. Well, we had a kid from America, but then she's gone to another university now. We have kids from Turkey. We have kids from South Africa. We have kids from India, obviously South Asia. I think the number of Indian kids has increased in the past 3 years. Yes. So my batch has around 10 to 12 Indian kids. But the batch after me, the first years, there are I think around 20 Indians. So you will have a really nice community, regardless of whichever university you choose. Almost every university has a good Indian. Every region has a good Indian community around it.
Okay.
Yes.
Mr. Rajesh, if you have any questions.
Do you have any more questions, Soumya, Mr. Rajesh, and Pranshal? You guys are asking I want to ask like how you're managing medtech degree. Like obviously it would be hard to manage both the engineering, like biomedical engineering with medicine. Okay, so basically what they do is they have the first semester is you focus on the medical engineering part, the biomedical part. So you'll give your exams in the first semester, and then the second semester is the medicine part, right? So it's not tough. It's not as tough as they make it seem to be. It's like a normal course itself. They have integrated a lot, so maybe like the portion increases. I know from a few of my friends that they have three parts of anatomy, but we have only two parts of anatomy because the portion is condensed to make so that it still fits into the 6 year course. But that doesn't mean that they compromise on priority. We just have extra long classes. That's if I am making sense to you. Basically, and the professors
professors are really chill, so you can always help out. And I'm not really sure if you know the exam pattern here. So basically, you do a lot of oral exams. So you're directly sitting in front of the professor and talking to them face to face, giving your exam. So it's out of 30, and most of the exams are oral exams. You don't have to sit and write these exams, and there's so the pressure significantly decreases. For me personally, I prefer the oral exams. Also, you can keep giving exams over and over again. So what I do is I don't take all of my exams in one single go. I will break. If I had initially I had six, I think five subjects, and I took the first three, then I took the next two. So in that way, I still have enough time to actually give each subject the required attention, and I know that I can perform my best there. So that is how I do it personally. But also, you can keep giving exams. We have exams almost every month, dates for exams every month. So whenever I feel, not whenever, I plan all of this ahead, because these dates are released quite ahead. So we have dates now since it's May, but we already have dates for exams in September. So I can plan how will I study, what am I going to prioritize, how many exams I can take at the same time. All of this by now. So I already have a schedule of how I'm going to study with all of my classes. So I think planning ahead is a good idea, especially when it comes to the studying part, and not waiting till the last moment. That's how I think I can manage, doing both the degrees. It's not a significant, or it's not, it doesn't feel a lot of burden, but that I think it's because of this particular reason. Is there anything else?
So you don't have any written exams throughout the year?
No, no, no. We do have written exams, but a majority of our exams are oral exams. So, for the first year, if I'm talking for the first year, we had physics and chemistry, and physics and chemistry and math, which was written. All of those were written. But then we have cell biology, which is going to be an oral exam. So you sit with the professor, and then the professor will ask you like a question. So your exam is basically done in like 5 to 10 minutes. And if usually for some people it is more scary, because it is difficult for them to think right in that specific moment. So sometimes the teachers will give you like prompt the answer a little bit, or guide you towards the answer. But it is also overall easy. A lot, I think they will let you know the study plan usually shows which of them are oral exams, which of them are written exams. A lot of the biomedical exams, right, the big exams are usually oral exams, where the teachers will sit and discuss what you understood, or they will ask you what you like. They will ask you questions, and you have to basically answer those rather than writing them down, because it doesn't make sense for these people here. How to prepare for IMAT, like in leftover months, in 3 4 months? Honestly, IMAT is not that difficult of an exam. It is significant. I mean, it's not an easy exam, but it is definitely not as difficult as NEET, in my opinion. I started my preparation in June, which was good enough for me, because I already did my NEET properly, so my concepts were in in a good place. But if you're starting from the basic, if your concept is not good, then I think starting from May is a good option, and like putting in the effort to understand the concept, because IMAT really tests your concepts more than how much just rot learning it. So basically, biology is obviously important. It has 23 questions: chemistry, physics, and math, and logical reasoning. So I would suggest, like, I think HEC has a course, will be releasing that course. So I think we have really good teachers here. They'll help you out. And so basically, focus a lot on, if your concept is good, then focus on doing a lot of questions. Okay. And I think having a goal in your mind, like having, oh, I need to score somewhere between 65 to 70 is my goal, then I will work constantly over it. With logic and reasoning, practice makes perfect. There is no set thing that you can do for that. So basically, just practicing is much more important. Physics and math is really, really simple, basic concepts. So again, practicing is really important here. Chemistry can get a little this, because sometimes the paper decides to go very simple. Like in 2024, it was very, very basic, but
Even
2025,
previous year, not
yeah.
much complicated even previous.
No, it was not complicated at all. But then the next year they decided to choose the most random topics and ask a lot of questions from it. So even if you're studying, I think starting from June, July, August, 3 months, more than enough, but practice a lot of questions. And if you don't know, so you just keep doing it. I think that is the best thing you can do.
Do
What
university
are the
provide dome rooms and all?
Yeah, the university does not provide a dorm. The regional government, the regional office have dorms that are allotted, and then you, depending on the scholarship, whether you get, you don't get, you get the dorms. And if you don't want the dorms, then you can always say that I don't want the dorms. I'd rather get the rent money. Then you can rent you can rent on your own. However, these laws I am not very, very sure about, like, not because these are
That I was
regional
talking
government.
about.
Yeah.
Basically, here the regional government, the scholarship body through which you get the scholarship also, they own the accommodation. It's the accommodation office different. So it's the government body itself. University department is to manage university, and there's a government department to manage accommodation for the student. So they allot you the accommodation if you want or if you don't want, based on your like choice. If you are getting university dorm or not. So yes, that's in university dorm also. But basically, it's a different government body which manage the accommodation. That's how system functions here in.
I have one more doubt.
Yeah, go ahead.
So, like the courses, the internship is included in the 6 years, or it is separate? Like,
No, no, it's basically for us, we begin clinical rotations from the third year, but the third year we don't really count it. You're just observing you're just observing professors. They will show you how the basics of the hospital, how everything works. And then from the fourth year, you actually start your clinical rotations. Here, the clinical rotation is not 1 year, it's the 3 years of your course, fourth, fifth, sixth, and you are basically doing both at the same time. So if you're learning about, if you're learning internal medicine, your rotation is going to be internal medicine. They don't wait, but like you don't do all your theory in 1 year or 2 years and then do your internship. It
Practical
is,
basically in India,
yeah.
you practical exposure very late. Here from
Mhm.
third year, they give you lots of practical exposure. Plus the final year in India, only final year is the practical exposure. Here from third year onwards, your clinical rotation,
Yes.
and final year comes as the internship or whatever you call it, clinical rotation.
Mm.
That's how it works.
so
It's like
how's
the
the patient flow
it,
there? Patient flow.
I mean, they have. It depends on the it depends on the region as well. But the university that I study in, they have the biggest hospital in my region, so we have a good amount of patients. You will, in fact, you work with. The best thing about studying in the EU is you are in the forefront of medical technology. We have air ambulances, even though my region is a pretty small region if you think about Italy in general, but we still have air ambulances. We have a collapsible ER, or like a ready to go ER, operating room in the ER, and this is this is available all across all across Italy, right? So you will be working with like really, really good technology, and you'll have good patients as well. Like really, the patient flow is good. You'll get varied cases as well, because especially in Napoli, I was talking to a doctor, and he told me that Napoli has really good patient inflow because it's like the poorer states, so they have their public hospitals usually get a lot of patients coming in. How's the academic there? How's the academics? Academics is like, it's like the way the professors teach. Yes.
it's like
Or
how's that
different
just
from India? Oh, how's it? Okay, so basically, I'm not really sure about how it works in India because I've not studied in India. My medicine is right here, right? But it is less from how much I speak with my friends who are doing medicine in India. I am living a very chill life, so I don't know if I should be complaining about me medicine being hard for me because they are studying 24 hours a day and still they're like, we need more time to study. I cannot say that. I am studying. In fact, I think we also have to write a thesis by the last year, right? So by the last year, so my academics is in a much better position than an Indian medical graduate. But I don't have to deal with the pressure, which was one of the most important things for
I'll
me.
give you a simple idea. The what happens in Indian medical college when I was in the college. You have to study whole anatomy just to enroll in the first year. Mug up all the things, go vomit in the exam. After that, none of the student was any first year student in India pass. Not a 20% in anatomy. They remember. We have to mug up pass exam after 5 years. No skill. That's what happened. That's the reason why I left it after 3 years. It's nothing. Professor comes, give PPT presentation, mug up those questions. Remember past 10 years papers of the university. Question will come from that in the exam. That's how the people pass even in Indian government colleges, because practical exposure, technology, nothing is there. It's just like that. And regarding Italy, you asked about academics and all those. This is the birthplace of modern medicine. The concept of anatomy originated from here. This Bologna process, the higher education system, that's originated from here. This bachelor, master, PhD credit system, the education system originated from here. You study about Golgi apparatus. Camillo Golgi was from Italy. So this is Golgi apparatus. You study fallopian tube, means fallopian was from Italy. You name it, all the medical things, that's originated from Italy. So, student first try to just clear the IMAT exam and to judge Italy academic university, for that bigger bodies are there or the university's ranking system, those are there. You as a student, if you are able to clear the exam and come to here, consider yourself lucky that you got the chance to study in Italy. So focus on the exams and energy
And
in
if I were to add to this, I think I have a new course that just started like 15 days ago. It is called molecular biology paper research. So to teach us how to write, how to do clinical research and how to write papers, right? We have this one small course for 4 days, right? And I was sitting and listening to this professor. He's one of his he I cannot remember his name, but he has invented a technique, or he discovered a technique that can help us see proteins much more clearly. And he's worked on many papers. He's worked on 4 papers that have been published internationally, and he's worked with MIT he's been working with MIT. And we have tunneling scanning microscope, SEMs and TEMs in my university as well. So this is the standard of education and academics that is available here. I am I did my 11th and 12th in St. Xavier's, which is in Mumbai, which is one of it's a very prestigious college. It's known. I mean, I'm a little proud of it, but it has the first microbiology lab in Mumbai, right? And that lab still does not compare. A prestigious college's lab still does not compare to this. So that is the level of academics we have here. I'm just bragging a little.
no, no, it's a fact. There's no comparison
Yeah,
between both the systems.
yeah.
Yeah, that's
Ma'am, the first question, what's the career prospect after your medicine?
Like I said, because of the EU, because I'm studying in an EU country, I can practice anywhere in the EU without having to give a licensing exam. I just have to register myself as a doctor there, and I can start practicing there. Also, with I am eligible to sit for the USMLE if I want to do so. If I want to come back to India, I can do FMGE. UK is also an option. Apart from that, if I want to get into clinical research, I personally believe Italy is a really good place to start because they have impeccable research opportunities. Even as a student, I can avail to them. So research, if you want to go into clinical research, that is also an option. If you want to do biotechnology, if you're doing a dual degree, because even Padua, like the University of Padua, is also offering
from this.
the dual degree. So if you do that, and if you are more interested in biotechnology, medical informatics, you can also join in that. So it is from my perspective, me as an Italian medical graduate have better career prospects, or I have a better standing than if I were to have done my medicine, or if I were to have done medicine in India. I don't have to struggle with giving a lot of licensing exams if I want to study abroad or like do my masters abroad. I don't have to struggle with giving those exams. I can just do them without much trouble.
So the university providing you the Italian classes,
Yeah,
language
yeah,
classes.
yeah. So basically, the course is taught in English, completely in English for all 6 years. But once you start clinical rotation, before you start clinical rotation, the patients obviously will not be speaking a lot of English. And if you want to communicate with the patients, Italian is a must, right? So the university offers Italian courses from the first year onwards. You can start taking them, and because you are surrounded by people who are constantly speaking Italian, apart from the university, once you go outside, right, there's a lot of people who are speaking Italian, and you keep on listening to it. And I think now I can understand Italian. I'm not very good at speaking it. I try not to speak it because I keep embarrassing myself. So I will practice on speaking for now, but then my Italian, I can understand it. So it is, though it seems very daunting to begin with, or like, oh my god, how am I supposed to learn a new language, blah blah blah, it is much more easier or simpler than it feels.
And Italian is a very fun language also to learn.
Yeah, it's so fun.
So Soumya and Pranjal, you have 3 to 4 minutes more left. You can please ask your query quickly. After that, we'll wrap up this session.
Do you get an opportunity to like do Erasmus program?
Okay, so with Erasmus, you can do Erasmus from the fourth year, at least for my university. The backdoor might be different for different universities. I'm not really sure, but for me, we have to do the first after the fourth year. That's, I also think it's because of the dual degree that we don't get to start Erasmus earlier. We have a much better, normal courses have a 6 month or 1 year Erasmus, but I think medicine, you can do a 1 year, 2 year Erasmus as well. So it's up to you.
What's
My
the
personal opinion. Yeah.
What's the PG opportunities after that?
I mean, if you want to do here, you'll have to give your language certification, and you can do whatever. Like, it's the same thing.
Same thing, wherever you want to do PG.
Yeah, wherever you want to do it, you can still do
Anyway,
it.
but again, I would like to mention PG is longing after 6 years. First, you
Yeah.
clear the IMAT, then we will see the 6 year journey.
Any other question?
No,
Yeah,
thank
sure.
you so much.
No, thank you.
You're welcome.
Thank you so much, Christina, for getting the time from your exam sessions and everything.
No worries.
But to help this student was, I guess, is serious to come to Italy. Soumya and maybe Pranjal also. So I requested you to come. Thank you so much for your time, for giving your
Yeah,
time.
thank you. Bye.
Okay, bye bye.